And I'm thankful for you guys for inviting me to come along, for the organisation that has taken place to get the event going, for the countless emails that we've exchanged, and obviously, Jacob will be testament to that. I'm a bit of a control freak, so, I've had various emails over the last few days and weeks in order to get here today, but it is my honour to be here to tell you the story of Kate and I, and to tell you how the hashtag hellomynameis really began. And it is a story that I will tell today. It's a story of Kate and I's life. It's going to be emotional, it's going to be personal in places, and I'm hoping it's going to be inspiring, because Kate truly was and is an inspiration to many, many people. She still continues to inspire me every single day, for reasons that I will come on to as we go through this morning's talk. And I'm going to break that down into 3 parts. So the 3 parts I want to talk about today are what's important to you in your own lives. I'm sure that everyone's got an important date in their life that's important to them. It could be the day you started working here, it could be the day you got married, it could be the day you gave birth to your first child, it could be a whole combination of things, but it's what's important to you. The second part is thinking about your own life plans. Where do you see yourself in the next 5 years, 10 years, wherever that may be. Kate and I certainly had a life plan, but that life plan obviously evolved over time, and now my life plan changes, on a monthly basis. And the third part of today's talk, and probably the most important part of today, is around what do you want to be remembered for when you die? What legacy do you want to leave in the world? Because I'm a firm believer that everybody can make a difference in this world. In some small way, everyone can make a difference. And if everybody makes a difference, then you know what? The world will be a better place for everyone. So what legacy do you want to leave, irrespective of what adversity you're going through in life? But just before we start, and this is probably not a question that I should ask in Milton Keynes, but hands up for those people that have actually heard of the hellomynameis campaign. That's great. Every hand is up there, you'd be pleased to know, Joe. Which I thought would happen, because obviously it's embedded, it's used every single day, it's endorsed by Joe, by everybody else in the organisation, and like I said, it's great to be within an organisation that really embraces the culture behind it. And over time, Kate and I started to talk at different events, and Milton Keynes was one of the places that Kate visited a few years ago now. So Kate and I met at the end of 2001 on New Year's Eve. We were in a nightclub in Huddersfield, in Yorkshire, slightly drunk, as you do on New Year's Eve, and we met. And Kate at that point was 2.5 years into a 6-year medical degree, studying in Edinburgh to become a doctor looking after the elderly. And her lifelong ambition was to become a consultant looking after older people. And despite her becoming terminally ill at the age of 29, she still achieved becoming a consultant before she died in her own right, which is probably one of the proudest moments, of my life and of Kate's life from a career perspective, becoming a consultant in her own right. So she was 2.5 years into a 6-year medical degree. The next 3.5 years, Kate and I commuted most weekends between Edinburgh and Yorkshire, because it was clear from the start that we were meant to be together. We were soulmates. We were going to spend the rest of our lives together. And, we commuted. A year after meeting, on New Year's Eve at the end of 2002, we got engaged. And then we started to plan our own lives, which revolved around 3 things. And those 3 things were travelling. We both wanted to see, the world. It revolved around our family life, so when we would get married, when we would think about having our own children, and so on. And then the third part, which, a really important part to both of us, was our careers. Like I said, Kate wanted to become and did become a consultant looking after the elderly. My background is not in healthcare. My background is 25 years in retail, the last 17 years of that working within the logistics supply chain for one of the major supermarkets based in their head office up in Yorkshire. Soon to potentially become part of another large supermarket chain, so that probably gives it away. But the last 17 years working for those guys, and they've been a huge support to me and to Kate over recent years. I was thrust into healthcare, obviously when I met Kate as a student, and as Kate went through her career as well, and obviously her treatment for cancer. So our life plans developed throughout that period. You know, and our lifelong plan was to retire, open a bed and breakfast at the coast. That was our plans for when we retired. You know, but obviously that will never happen now, unfortunately. So then we move to the 23rd of July. So the 23rd of July is the most significant date in my life, and I'll keep referring back to the 23rd of July as we go through today's talk. 2005, Kate had just finished in Edinburgh. She returned to Yorkshire to start a job and working at a local hospital, and we got married. You know, it was a beautiful day surrounded by amazing family and friends, a beautiful ceremony. And we actually got married at around 3:20 in the afternoon. We said our vows to each other at about 3:20 in the afternoon, which is a relevant time as well for reasons that I will come on to later on. Kate was actually late to the wedding because she was listening to a certain cricket match that was going on in the car. And, you know, one of those things that we enjoyed to do was to go and watch cricket, or to watch cricket on the TV, something that was important to Kate and I, and like I said, and that will also play a part as we go through this morning. But as part of this, the 23rd of July is my most significant date. So the early years of married life were quite idyllic. They were quite normal, whatever normal is these days. You know, what is normal? We had a beautiful home, we had amazing family and friends around us. You know, we had very little financial worries. Life was good. You know, we travelled a lot. You know, nothing seemed untoward. We then moved forward to 2011, and my cousin in America, in California, had given birth. So we wanted to take my grandma to meet her new great-grandchild in 2011. So, you know, we went across California. My auntie and uncle picked my grandma up from the airport, and then Kate and I continued our travels across California. Now, everything seemed okay to the outside world, but Kate just wasn't feeling herself. She had lower back pain, she was quite lethargic. But Kate, being the doctor that she was and wanting to enjoy the holiday, she was taking paracetamols and ibuprofen, but she just put that down to jet lag, she put that down to staying in different hotels, to travelling in different vehicles, and sort of brushed that off and said, if it continues when we get back to the UK, I'll go and see my local GP and we'll see what's going on. This picture on screen is actually the last picture that we've got of Kate and I before I found Kate writhing around in complete agony on the bed in my uncle's house with severe back pain. And it was at that point, as the non-medic in the relationship, that I said to Kate, look darling, we need to take you into ER in America. We need to get you into hospital because we can't carry on like this because there's something seriously wrong. It turns out if we hadn't have done that at that point, Kate would have probably died there and then in America with acute renal failure, because the scans that we had when we went into hospital in America showed you know, an amount of tumours across Kate's lower abdomen that was blocking her kidneys. She had some stents inserted to drain her kidneys in America, and she had further scans and tests whilst we were there. And we were only there for 2 nights. You know, we were in hospital 2 nights in America before she was made fit to fly back to the UK to pursue further treatment within our amazing NHS. The hospital bill in America, just for context, was $30,000 US, which we had insurance for, obviously, so you know the money side of it's irrespective, but it was more to appreciate the amazing NHS that we have actually got in this country, and for people to appreciate how we need to continue to do what we can to save the NHS and to celebrate 70 years of our amazing NHS. So yeah, we were made fit to fly home back to the UK, and all the tests and all the scans that we had when Kate went into hospital in the UK showed the worst case scenario. And she was eventually diagnosed with a desmoplastic small round cell tumour, which is a very rare and aggressive form of sarcoma that normally impacts adolescent boys. So why it had picked on a 29-year-old female, we'll never know. But Kate and I's philosophy in life was always to play the cards that were being dealt in life. You know, we can't change them. You know, it's just how our lives were meant to be. So we could have just sat around and thought, why Kate, why this, why that? But you know, we had to just crack on as best we could to enjoy life and to make the most of our time that we had together. Her prognosis was 6 to 12 months to live at that point. So middle of 2011, you know, Kate was 29, I was in my early 30s. She was given 6 to 12 months to live. Our life plans were thrown in the bin. We had to start again. We had to concertina our lives into what time we had left together. She was in hospital for 4.5 months out of the next 6 months. And throughout that time, she started to keep a diary of events. seeing it through the eyes of a patient as a doctor. And she released a book called The Other Side, which is still available to buy today, with all profits going to charity. She wrote a second book as well called The Bright Side, which once again, all the profits go to charity, and details are on the website. She also had various conversations with her consultant and with other people about what her wishes were. And we came up with a bucket list, and the thing that was at the top of that bucket list was to renew our wedding vows, which we did in early 2012. The second thing on there was for Kate to return to work. The one thing that Kate wanted to do in her career was to return to work, looking after older people, because she wanted to still make a difference. Even though she was facing her own mortality, she still wanted to make a difference. She also set various fundraising targets while she was in hospital. So it started off at £1,000, then £5,000, and so on, because, like I said, she wanted to not be remembered as the girl who died tragically young of cancer. She wanted to be remembered as somebody who made a difference in this world, even from those early days of diagnosis. So we then moved to New Year's Eve at the end of 2011, and Kate and I were in a side room in a hospital in Leeds, watching the fireworks over the city skyline, and we started to talk about the year that had gone and the year that was to come. And Kate simply said to me, "Look, I don't know where you're going to be this time next year, but I won't be here. I was given 6 to 12 months to live 6 months ago, so chances are I'm not going to be here." And we made a decision at that point to stop chemotherapy, because the rounds of chemotherapy Kate had with the ongoing infections and other things, quality of life just wasn't there. So the quantity of life that Kate had left versus her quality of life were just out balancing each other. So we said, look, let's stop chemotherapy for now, get back to as normal life as we can for as long as we can, and enjoy life. 3 weeks after making that decision, Kate was there, back on the wards, doing the job that she loved to do as a doctor, looking after older people 3 days a week. And it was one of her, once again, a proud moment when she could step back on the ward to do that job. And she didn't know how long she would have left to do that job, but she was back on the wards making a difference to older people. She was also starting to become some kind of healthcare celebrity, some kind of healthcare inspiration. And she was asked to go and speak at various events across the UK and across the NHS. And as part of this, she came up with her own core values, which are born out of examples that she had while she was in hospital. And these now resonate with us as part of the campaign. So I could now tell you about Kate's values and the values that we hold with the campaign, but rather than me talking, I'm going to let Kate talk for the next 10 minutes about the values. And this was taken in 2014 at a conference, so she does mention hellomynameis as part of this. When we come back from the video, I'll then tell you how the campaign started, where it's going, and what the future holds for both me and for the campaign. But for now, I'll just hand over to Kate.
Hello, my name's Kate. What I thought I'd do with my time today is perhaps tell you about some of my core values as a clinician and a patient, and why those are important to me, and tell you some stories about my experiences and why those core values have emerged in my thinking. And my first core value is communication. Everyone bands around communication being important, but I've really seen what harm bad communication can do as a patient. So if you can, try and put yourself in my position. I'm 29 years old, I know I've got cancer. I think it's confined to my abdomen, so I'm probably expecting to have an operation and maybe some chemotherapy and possibly a cure. I'm in a side room in an admission ward. I can hear everything that's going on outside because I'm right by the nurses' station. I'm in pain. I'm alone. And a junior doctor comes to see me to talk to me about the results of my MRI scan that I'd had earlier in the week. I'd never met this doctor before. He came into my room. He did do hellomynameis. He sat down in the chair next to me and looked away from me. And without any warning shot or checking my baseline understanding or asking if I wanted anybody with me, he just said to me simply, "Your cancer has spread." He then couldn't leave the room quick enough, and I was left in a deep psychological distress with the nurses not knowing what he'd told me, and I never saw him again. I think I'm a little bit, wouldn't like to admit, but a little bit psychologically scarred by that experience. We break bad news in the NHS every single day. It's going on as we speak. But how we do that, we really need to think about what's left with that patient and how they have to live that story. On the converse side, when my oncologist told me my final diagnosis, I had a much better experience. I'd got to know him over the few preceding weeks. He'd asked me if I wanted somebody with me at that point. I didn't. He gently sat down beside me, actually on my hospital bed against the rules, held my hand and gently told me my diagnosis. He then sat in silence and let me take that in and the eventual emotional breakdown that followed. That experience, although probably more devastating news, wasn't as distressing for me as the first experience. My second core value as a clinician, if anyone's heard me speak before, is about the little things. I really think the little things matter when you're a patient, and they're what can make the difference between a good experience and a bad experience. When I say the little things, I mean somebody holding your hand, I mean somebody introducing themselves, I mean somebody sitting down next to you instead of standing over you. I mean somebody taking that extra moment to really listen to your fears and anxieties. I was very sick a couple of months ago, probably the sickest I've been on my journey, and it was a Saturday night and the on-call oncologist came to see me. And beside all the other things that he did for me, including phoning the on-call urologist and talking to the radiology doctors, talking to the microbiology doctors, changing all my treatments around, the one thing he did was kneel down beside my bed, put his hand on my arm gently and say, "Kate, you're going to be okay." Because he'd recognised how frightened and vulnerable I was feeling in that situation. A few days later in that admission, a registrar came to see me, and she wanted to talk to me about the positive blood culture results that I'd just received. This was very scary for me to have a bacteremia, and she refused to sit down when I asked her to take a seat in the chair that was right next to my bed. She thought that I was asking her for her own benefit, but I wasn't. I was asking for my benefit so that we could have a conversation on the same level. Instead, she stood looming over me, making me feel little and less in control. Those little things do really matter, and everyone can do them. My third key value is that person-centred care. This is a phrase that's bandied around the NHS and NHS management and leadership all the time, but what does it really mean? In January, I was admitted to hospital with febrile neutropenia. At that time, I was put on the standard antibiotic protocol, given some intravenous fluids, reviewed by the consultant and transferred to another ward. On that ward, a nurse came to give me my antibiotics at lunchtime. The antibiotics have been changed from the standard protocol, which is a drug called tazocin, to something called meropenem, which is used for much more serious infections. I didn't know anything about this change in antibiotics. The first thought that went through my head was, has she got the right drug chart, or has somebody made a prescribing error? The second more worrying thought that went through my mind is, oh gosh, they've got the meropenem out, they need to use a domestos, I must have something really serious. Looking back through the medical notes, what had happened was the consultant oncologist had reviewed me. He'd been very diligent and looked at all my microbiology results on the computer. He'd found that I'd grown a multi-resistant E. coli from my urine a couple of weeks earlier, and correctly asked the junior doctor to phone a microbiologist for some advice about this. The junior doctor had done the task that she'd been asked to do. She phoned the microbiologist, clearly documented in the medical notes what they said, and changed my antibiotics appropriately. That was an episode of safe care. I received the right treatment in a timely fashion. However, it forgot one thing, and perhaps the most important thing, which is me. And I think if it could be written in big bold letters across my medical notes, then anybody who knows me is that I want to know absolutely everything. So this was a serious change in treatment that had been forgotten to tell me. And I think that's something that happens. I've done it as a junior doctor, I'll admit it on this stage, that you tick your jobs list and you get so ingrained in that you've got all these jobs to do when you get stuck in this system that you forget the patient. For my first job, I worked in Dewsbury Hospital, and I worked for a doctor called Dr. Kemp. He was a diabetologist and a very wise physician coming towards the end of his career. He took me under his wing as he knew that I wanted to become a physician. And he said to me one day, "Kate, being a physician is about painting a picture. It's not about ticking a box or following a protocol. And during an admission, you'll fill in extra bits of the picture every day until you've got a full painting." I think that kind of relates to William Osler, who said the same thing many, many years ago. And that links to my fourth key value, which is about seeing me, not just my disease. I've been referred to within earshot by several consultants as that girl with DSRCT. Within one sentence, I've been reduced to just somebody with a rare cancer and nothing else. At a vulnerable time in my life, when I was feeling pretty low emotionally anyway, that's not something that I want to hear. I'm much more than just a rare cancer. I'm a wife, a daughter, an auntie to a new baby in a few months. I like to play the flute. I'm an avid baker. There's lots and lots of things about me that are more important. And this has become something that's very important to me in my clinical practice now I've returned to work since being diagnosed with cancer. I want to know more about my patients so that I can contextualise their disease within their own lives. And that's extremely important for what I do as an elderly physician. People have got loads of stories to tell you about their lives. I've looked after a gentleman who was an Olympic cycler in his day, and people had written him off as being, too frail to do any more treatment for. But actually, if you asked about this gentleman, he'd been walking up mountains the week before he got ill with his pneumonia. So I fought for his ICU admission and he got better and left hospital.
So I think hearing firsthand from Kate about the values is obviously quite emotional. It's certainly emotional for me every time I see that video, but also it sort of brings it to life because it was real life examples that are behind those values. Like I said, we renewed our wedding vows early 2012. This is just a picture from that ceremony, and once again we were surrounded by amazing family and friends that really helped us celebrate that day, but also tinged with a bit of sadness as well because of the reasons behind it. But it was something that we wanted to do, the first thing we wanted to do when Kate was diagnosed. So we then moved into 2013, and Kate throughout 2012 had a period of fairly good health, quite a stable kind of health across the year. But then the cancer returned early 2013, and we had to have further chemotherapy. And as part of Kate's treatment as well, she had to have her stents replaced every so often. And it was following one of those stent exchanges where Kate was back in hospital on a ward in Leeds, and that's where the campaign really starts. So on this one particular day in August 2013, Kate was being seen by a variety of healthcare workers, nurses, doctors, consultants, various other people coming to see Kate on this one particular day. None of them were introduced themselves. The nurse was coming to take Kate's blood, didn't ask for Kate's date of birth, was talking to another nurse at the same time, so not really engaging in conversation. The consultant came to see Kate with their entourage, stood at the end of the bed, looming over Kate, something that Kate hated. And like she said on those values, it's being at the same eye level as the person that you're looking after is an important factor. But then we met Brian. Now, Brian had a name. Brian introduced himself to us. Brian was a porter, and he came to take Kate down to theatre on this one particular day. He was talking to Kate and I on the way to theatre about things going on outside of healthcare, so he must have picked up on at some point that Kate liked cricket. So he was talking to Kate and I about a recent cricket result that had gone on. He was talking about the weather. He was talking about things that were outside of Kate's health. Something to really make Kate more comfortable on the way down. And that evening Kate and I were talking, and I think for those people that work for me in the business I work in, and for people in the world, there's a lot of people out there in the world who are happy to whinge and moan about things going on in the world or in their own lives, but they're not prepared to go and do something themselves about it. And for those people, I'd just say to them, look, you need to stop whinging about this, or you need to do something about it. Why can't you make a difference? Why should you expect other people to make that difference? So that evening Kate and I were talking, and Kate was starting to whinge about the lack of introductions on this one particular day. So I just said to her, look darling, you need to stop whinging about this, or you need to go away and do something, because you can't carry on moaning if you're not prepared to do something about it. At that point, Kate had around 25,000 followers on Twitter, on social media. So we said, why don't we use your already big social media presence to start a campaign called something like, I don't know, #hellomynameis. And it was born. It was born between a terminally ill lady and her non-medic husband on the 30th of August 2013 from one simple conversation. The next day, Kate sent me home to design a logo. I didn't design the logo for the campaign. One of our designer friends did that for us. But what we said to them is it has to incorporate a smile, because it's hard to say those 4 words and truly mean it without smiling at the person that you're talking to. And this doesn't have to just be in healthcare. It doesn't just have to be a healthcare worker-patient relationship. This could be, 2 doctors who've not met before. It could be a locum that's come into the hospital. It could be agency staff. It could be a whole combination of people. It doesn't just necessarily have to be that doctor-patient relationship. But that's where it started. It started in healthcare. This was the first tweet that Kate sent, about the campaign that we were going to start. Kate's brother then designed a website for us that's still in operation today, and that details upcoming events. It's where you can find out more educational resource. It's got a huge photo gallery on there. It's where you can buy Kate's books and other merchandise that we've got now as part of the campaign. Anything listed on the website, they have to donate a part of the sale to the charities that we support as well. So you can trust that they are going to donate to the charities. We were then getting asked to write in various journals. So Kate was asked to write in the British Medical Journal, and this is just an article I picked out showing the doctor-patient relationship on the same eye level and the simple introduction, which is only the start of that relationship. But I suppose it's poignant at this time to say, I know and Kate knew that many thousands of healthcare workers across the world would always introduce themselves, and have always introduced themselves even before the campaign started. So what we're not doing with the campaign is we're not patronising those people that have always done this, because there will be many thousands, hundreds of thousands across the world that have always done it. But because of the uptake that we were receiving, and because of the amount of photographs we were getting, the amount of times it was being used in conference literature, on name badges, on lanyards, we knew that the campaign was needed as a prompt and a gentle reminder of the importance of that simple introduction to people. Like I said, it was being used by students. They're having selfie campaigns. We've actually got the selfie board outside today, so if anybody wants to use that to have pictures afterwards, by all means go ahead and use it and tweet the pictures out accordingly. It was starting to be used in the police force in certain parts of the UK as well, as a way of diffusing the situation in the police. Like I said, people were doing charity cake sales because Kate was a keen baker, but she also wanted to raise thousands of pounds for these charities, so people were getting behind it from that respect. And before we knew it, we started to have some kind of global movement on our hands. It was a social phenomenon that was going on across the world, and people, the uptake was huge. all through the power of social media. Kate was then asked to go and speak at the Quality Forum in Paris in 2014, and it was at this point where Kate started to talk about her own legacy. It was being used on the main stage by all the keynote speakers. Kate was being asked for pictures and be talked to in the conference hallways, and she was, that inspiration. She is that healthcare celebrity that people wanted to have pictures with and talk about the campaign with. And on the train on the way back from Paris, Kate said to me, "Look, Chris, if I was to die today, I know that I've made a difference. I know that our campaign, will carry on for many generations to come. And I know that I can die happy knowing that I've created a legacy for the future." She also managed to indoctrinate her own healthcare heroes, Don Berwick, at this conference, which was a proud moment for Kate as well, because like I said, he was her hero in healthcare. So this campaign started in a hospital in Leeds, through those examples that Kate talked about. So they didn't want to be remembered as the hospital where this campaign started, and they didn't do anything about it. They now hugely endorse the campaign. Their chief exec talks about the campaign at every induction that takes place. I know that happens here as well. He endorses it, but he doesn't enforce it upon people. So there's a key difference there around the endorsement versus an enforcement. It doesn't want to become a tick box exercise. It wants to be something that people are actively willing and able to do, and I'm a firm believer that people do that work in healthcare. This hospital as well though, Kate worked in Leeds for a time. So some weeks Kate would be going into the hospital to have chemotherapy for the cancer that was killing her. But then other weeks she'd be going into hospital to look after older people, to be a doctor. So her mental balance had to be strong in order to keep that up. And it was. I mean, don't get me wrong, there was some dark times as well in our household, and I don't know how Kate got through it sometimes, but her strength really shone through because she knew she was making a difference to other people. And she knew that she just had to carry on because she wanted to become that consultant. We also set up in 2014 the Kate Granger Compassionate Care Awards, which were set up by the NHS to recognise individuals, teams and organisations across the NHS that have gone just above and beyond on compassionate care. Now, for me, as a non-healthcare worker, I think everyone who works in healthcare deserves these awards because everyone does an amazing job every single day. But like in any industry, you've got to have awards to recognise those that have gone just a little bit above. So these were set up in 2014. So Kate presented them 2014 and in 15. I presented them in 2016 and 17 and present them again this year in September. And last week we actually released this year's nomination forms for people to nominate individuals, teams and organisations across the NHS that are up for these awards. So if you've not seen that, I'd recommend going onto the NHS website and nominating people that you think are worthy of these awards, the Kate Granger Compassionate Care Awards. But the awards are now not just something in the NHS. So last year I was humbled to be asked to present certificates to those people in our wider emergency services who were first on scene at the bombings that took place in Manchester. And it got me thinking about life. It got me thinking about how fortunate Kate and I were to know that she was going to die, because we could talk about the things that we wanted to talk about. We could visit places we wanted to visit. We could have those conversations because we knew what was to come. Those people that went to those concerts and those people that get caught up in the atrocities that happen in this world nowadays don't have that time. So my encouragement to everyone is make sure that we're talking about our wishes for when we do go, because it's going to happen to us all at some point, and we need to be a bit more open to talk about death and dying in society. And it's something that Kate was a firm believer in, openly talking about it. And I know that next week it's Dying Matters Week, so something that will be spread around, talking about death and dying. The awards have spread across more than just the NHS. So a few weeks ago I was in America presenting the global Kate Granger Compassionate Care Awards. In a few weeks' time I'm down in Barcelona presenting the European Kate Granger Compassionate Care Awards. And various trusts across the UK have got their own versions of the Kate Granger Awards, because her name is now symbolic with compassionate care, and her name people recognise as somebody who made a difference to communication and compassionate care. And those are something that I'm really proud of, going and presenting these awards to amazing individuals and teams that work across healthcare. We also, I might press the wrong button there. Back up, here we go. Also, if you've got something that takes very little time to do and costs very little money but improves patient experience, which are the three big selling points of the campaign, then the politicians want to get involved. And Kate and I were asked to go and speak with the then Prime Minister David Cameron at Downing Street. We had a very productive meeting with him in the cabinet room about the campaign. We were asked to go and speak with Nicola Sturgeon in Scotland as well about the campaign, and she actually gave some money to the campaign up in Scotland. I was back up there last year giving her an update on where we are with the campaign, and she updated me on what they're doing in Scotland behind the campaign in NHS. She had a hospital unit named after her down in Watford, the Granger Suite, which we opened in 2014. And there's a picture of Jeremy Hunt outside the Granger Suite with his "hellomynameis" sign. And it was also used in the government's response to the mid-staffs inquiry that took place around communication and compassionate care and some of the failings that took place. We also have a variety of celebrity and business leader endorsements for the campaign. So for me, non-healthcare, how can I help with the campaign? You know, I've got quite a few contacts from the business that I work in, and you know, just being quite belligerent on various items on social media, managed to get a lot of people to endorse the campaign. So there's a few notable ones on there. So Sir Richard Branson was a big endorser of the campaign, and I'll come on to talk about him a little bit more in a short while. Bob Geldof's on there, Michelle Roux Jr., because Kate was a huge fan of cooking and baking, and she wanted to eat at some of the nice restaurants in the UK as part of her bucket list. She also wanted to see various concerts. So one of the people that she wanted to see in concert was Kylie Minogue, which that's easy to organise, isn't it? Everyone can buy a ticket to go and see a concert. But for me, I wanted Kate to experience the best in life because she truly deserved to experience the best in life. So I went out of my way to get her to meet these chefs or to go backstage and meet Kylie Minogue. And like I said, yes, it's great for the campaign, but most importantly, it was to give Kate life experiences that, you know, she deserved because of the work she was doing for other people. We then relaunched the campaign in 2015 in February. We managed to touch around 400,000 NHS staff on this one day. But in our household, it's quite a difficult day because Kate was up early doing radio work to promote the campaign. She was then into hospital to have poison because the cancer had returned. She then had to use the nurse's office at lunchtime to do an interview on the Jeremy Vine show before returning to having further chemotherapy, and then she was into the TV studios at night to do some more work on media. All day long, she was on her phone because the hashtag was trending. She was wanting to reply to everyone that took time to message her, and you know, it was a difficult balance for her to achieve in that particular day, but she achieved it. We then consolidated all the invites that Kate was receiving to go and talk at various events into a one-week UK-long tour, which took place in June 2015. We managed to take in 16 trusts in that 5 days. The 16th talk that Kate gave was equally as good as the first talk. And like I said once again, she was an inspirational figure across healthcare. And I know that I use that word quite a lot, and it gets used quite a lot in society, but in our household, the word inspiration was banned. Kate would not let me use the word inspirational because she didn't see it herself. She just thought she was doing good for others and she wanted to achieve something in life, which she did, but now she's not here with us. I can call her inspirational because she was and continues to be. She also received accolades on the back of that. So she received her MBE from Prince Charles. We were invited to go and meet the Queen at the garden party. She was the youngest ever person to receive a fellowship from the Royal College in London and in Edinburgh. And then she was also asked to open schools and universities and have her name displayed outside those establishments, which obviously continue today. She also had other items named after, like I mentioned before, in Watford. There's a lot of hospital units now named after her. So this campaign is not just an NHS thing anymore. Like I've said, we now operate in over 20 countries across the world, and what I want my legacy to be is that we operate in every country in the world, or people know about the campaign in every country, and people know the story behind it. They know the inspiration behind the campaign. Just recently we had some photographs sent to us from the Antarctica where people were using it when they were looking after people in the Antarctica. So we do operate in every continent, but not in every country as yet, but we will do at some point. So as we move into 2016, the time between Kate finishing chemotherapy and the cancer returning was getting shorter and shorter, so we knew at some point we would have to go into a palliative situation, and that happened sort of spring 2016. Kate then moved into the St Gemma's Hospice in Leeds in June 2016, and it's a place that she'd done 2 talks at in recent years, so we had a good connection with them. An amazing establishment, great staff, doing the little things really well, and those little things could have encompassed anything, but one of the things that they did for us was they had password protection on anybody that wanted information about Kate, because the media wanted to know what was going on, for either the right reasons or maybe the not so good reasons, but the media wanted to know, so we were getting loads of phone calls from media outlets. So putting a password on there was the right thing to do, and they did that for us. But even before Kate died, she still set challenges. The 2 challenges that she set before she died was, one, to reach £250,000 for the charity that we support, and secondly, to get the new Prime Minister Theresa May to endorse the campaign. The first one, getting to £250,000, was relatively easy, using the power of social media and very generous people and organisations that got us to £250,000. And the picture there is Kate and I celebrating reaching that in the hospice with a glass of fizz that they provided, reaching that milestone. The second one was a little bit more difficult, but given the contacts that we'd amassed over the recent years, we still managed to get Theresa May to endorse the campaign, and she sent a handwritten letter to Kate saying, "Dear Kate, hi, my name is Theresa," and then she went on to talk about how proud the country were of what Kate had achieved in her life, but also how proud Kate should be of what she'd achieved in her life as well. And that was a handwritten letter that had come from Downing Street just a few days before Kate died. And Kate acknowledged receiving that. So those 2 tasks that she set for me and for the campaign, we achieved. We then move on to the 23rd of July again. So the 23rd of July 2005 was the happiest day of my life. 23rd of July 2016 was our 11th WEN anniversary. So, we managed to celebrate very slightly first thing in the morning, and Kate recognised it was our WEN anniversary on that morning. As the day went on, obviously Kate became more and more drowsy, and she passed away at 3:20 in the afternoon on the 23rd of July. So like I mentioned at the start, the 23rd of July 2005 at around 3:20 we were saying our vows to each other. The 23rd of July 2016 at about the same time is when Kate passed away, which was obviously the saddest day of my life so far. But also in some ways, it's a day where I found peace, and the family found peace, because we knew that Kate wasn't in pain anymore, because the journey that we'd been on of the previous 5 years, in some places was horrendous. The pain that Kate experienced, which probably not many people will ever see, and certainly those who have never seen it for Kate, was horrendous. So to know that she wasn't in pain anymore, and to know that she was at peace, gave us some comfort. But once close family and friends had been informed of Kate's death, Kate lived a lot of her life in social media. We had to put a tweet out there to say that she'd died, and within minutes it was BBC breaking news. We were getting messages of condolence from across the world. The Prime Minister led those messages of condolence, and Jeremy Hunt did. Sir Richard Branson sent a really public tweet and a private message to me and the family, and various other places were sending messages. And it just showed the love and support that Kate had made in the world. And when I talk to a lot of people now, they all often tell me that when they saw that tweet about Kate dying, it was like a Princess Diana moment. Everybody knew where they were when they saw that tweet. Everybody knew what they had to go and do when they saw that tweet, because she was such an amazing individual that sort of made a difference in this world. And everybody, like I said, knew where they were and that they had to take a bit of time to themselves. So that was the 23rd of July 2016. Since that point, I carried on working in my career up until September last year, when I decided to take a 12-month sabbatical to take the campaign on a global tour. And once again, this is something that Kate and I actually talked about before she died. The plans for me for the future was to do some kind of global tour. One, to help continue to promote the campaign, but secondly, to travel to parts of the world as well that Kate and I never got to together. So that started in September, started in Australia and New Zealand, it's travelled around the UK, it's been to America and Europe, back to Australia, back into the UK. We've also, about 6 months ago, we commissioned a playwright to write a play all about Kate and I's life, and that's actually premiering next week in Leeds, and then it's going on to Southampton, into London, and travelling across the UK at various places, telling our story in a different format. I'm in the middle of writing a book to hopefully help other people going through something similar to what I've been through, and to make a difference that way. And it's also going to encompass all of Kate's blogs into one place. One of my friends wrote a song that he wrote and sang and produced, and that went to number 7 in the download charts on its first week of release. We've also got various other forms of merchandise that we sell on the website as part of the campaign. So we have mugs, we have, like I said, the card holders, lanyards, various other things. And the reason for that, the reason why I took the 12-month sabbatical, the reason why we continue promoting the campaign and selling various items and continue to sell Kate's books, is because I set a new target for the campaign of reaching £500,000 by the end of this year for the 2 charities that we support. So everything that we do is for the charities that we support, which are the Yorkshire Cancer Centre and the St Gemma's Hospice in Leeds. We're currently at about £360,000, so we've moved on a little bit from 2016, but there's still a long way to go to get to £500,000. But we will reach £500,000 by the end of this year, and then the target will probably increase to £1 million, and who knows where it may go, but we will reach £500,000 by the end of this year. This is just a few pictures from the tour so far. So like I said, the uptake down under was amazing. They use it already in various hospitals across the UK. It's amazing to come to trusts such as this, where you can see the campaign is fully embraced, fully endorsed, and it's seen by everyone to be making a difference. And we do have people that have done surveys on does it make a difference or not, which I get. People like to have evidence behind campaigns and things, but for me the question is, why would you not want to do this? And it makes a difference to one person, then it's done its job. It's also used as part of the leadership framework in the NHS, so the number one thing on there is about introducing yourself. I've written some blogs for the Leadership Academy as well, looking at it from a business perspective into healthcare. We've had almost 2 billion Twitter impressions now since its conception in 2013. We have ambassadors across the world. It says on there we treat 1 million people every 36 hours in the NHS. I think that's more like 1 million every 30 hours now. But irrespective of the numbers, if this campaign makes a difference to one person anywhere in the world, in healthcare or beyond, then it's done its job. It's made a difference to that one interaction. And for us, that's pleasing because we know we've made a difference. Obviously, it's made a difference to more than one person, one interaction, but if it was only one, then it'd still be all worth it. And it's also now used as part of the Oxford Handbook of Clinical Medicine. So Kate is now part of that handbook, which is in its 10th edition, and that will continue for many editions to come. So the 23rd of July. So the 23rd of July, every year going forward, is going to be recognised as the International hellomynameis Day. And I'm open to ideas on how we celebrate that. If you want to get in touch with me via the website, there's forms on there to contact me, but any ideas are welcome. But the reason why I want to do this, and the reason why it will happen every year, is one, to continue the campaign, keep refreshing it, keep relaunching it in trusts that are either using it or aren't using it as yet. But secondly, to remember the amazing inspiration behind the campaign that was Kate. And that's why the 23rd of July is such a significant date in my life and will always be going forward, because like I said, the day that we got married, the day Kate died, and also now it's the International hellomynameis Day every year going forward. So I've talked about the important date for me. My life plans over the next few weeks and months are going to change significantly again. I've got some decisions to make about my career and what I do next. And I've told you about my legacy and what I want my legacy to be, but I'm just going to let Kate finish off with her own legacy, and then I'll come back.
I'd like my main legacy to be a better NHS that considers patients as people, not just diseases or conditions. And I hope I've managed to achieve that a little bit by making people stop and think about how they communicate with people.
So once again, it's been my complete privilege and honour to be in a room with such amazing people, because you guys make the difference every day to people out there. And like I said, once again, thank you so much for the invite to come in to speak, to share the story. And I'm happy to take any questions at the end of the session, or outside and wherever. But yeah, thanks again for everything that you do and continuing the campaign in Milton Keynes.